All right, we're moving right along to the primary assessment. So this part of our skill can really be broken down into three portions. So I like to say just above airway, those three boxes are really our first section. And what we're going to do here is we make a general impression of our patient. And that is basically looking from across the room saying, are they sick? Are they not sick? We can do that from across the room, as well as determining their responsiveness and their level of consciousness. Using our AVPU scale, are they alert when we walk in the room? When we say something, does this patient respond? Give them a pinch. Are they responding to pain, or are they unresponsive? That's something we can determine right off the bat, as well as a chief complaint. This one, based on our mechanism of injury and any injuries that we see when we expose the patient, first thing, we can make up a chief complaint. What's most important here, and do they have any life threats? So the next section is the ABCs. Very important, something that we've talked about. But to break it down for the lab purposes, we're going to open and assess the airway. If an adjunct is needed, we'll go ahead and insert it. Nothing to it. We're just making sure that airway is open and patent. If they're talking to you, it's open and patent. Breathing. Assess breathing. How good is it? How fast is it? How slow is it? Assure adequate ventilation. Are they moving air? Administer oxygen if needed, as well as manage any injury that they may have, compromising breathing and ventilation. Now, this is something that we'll see pretty often in our trauma labs, is having to go in and fix something wrong with ABCs. All right, circulation. We're going to check that pulse. We're going to assess that skin. Control major bleeding if it's present. Hopefully not, but if it is, we're going to control it. And then if we see any signs of shock, we're going to manage that shock. Check that pulse, assess that skin, control that bleeding, manage that shock. And then based on what we've got going on, we're going to make a transport decision. So patient GCS plus, is this a load and go situation? Is this a stay and play? That's up to you. You make that decision. All right.